where to start. I mean, just so people know where I am, I'm in Kent, which is like the 10th diverse city, even including like New York City and all that. Work in a community health center, uninsured, mainly Latinx community, but a mixture of refugee populations. And I mean, the moment COVID started, I had a feeling and knew that this is just going to be a repeat of any other chronic disease and any other health indicator we know. You look at the King County maps for disease, and you look at the COVID map now, it fits exactly. You take any healthcare risk factor, and anybody in public health probably saw that coming. And so, like a couple of weeks in, I just knew that was going to happen and worried. And then the data started coming out. I mean, for those that don't know, I don't know if you guys have discussed it or not, but it's like I think in Washington State currently, Latinx population makes up 13%, but they're 42% of the cases. And so obviously it's impacting CMAR community health centers a lot. We're trying to do our part as far as testing and whatnot, and radio ads, and trying to build that trust and trying to get word out into the community. But it's limited, as the two panelists before us discussed, like when the structure of the society is baked into the bread. And so to build something on top of that bread and to act like it will, whether it's testing or a vaccine, whatever it may be, you're going to come back to the status quo eventually of inequities. And so personally, I think the George Floyd rebellion during this time might be the biggest blessing that might come out of all this in a sense. In my lifetime, I've never seen any movement towards something that might be a solution. And I don't think there's any like XYZ answer, but the movement itself is the biggest solution I've seen towards these things that we'll just see over and over again. This year is COVID. Let's say next year is going to be some other disease. These diseases are supposed to increase year after year. So I'm interested in discussing COVID. I realize the urgency of it now, but it's going to be something else in a year. It's going to be something else in 2 years. It's going to be something else in 5 years. And unless we dismantle the home, not using the master's tools, we're going to be back at the same spot. Yeah, we see it day in, day out. Some personal, like some stories on the ground. I mean, as a physician, I'm trying to think of some stories I wrote down, like 70-year-old patients that want to be cleared for work so they can make a living after having to take a break to avoid getting sick with chronic diseases. Multi-generational households with 10 people in the house, all infected with COVID. Another multi-generational house that I take care of the whole family, and the grandfather or the oldest person in the home had multiple comorbidities. He died from COVID in the hospital. His son got clots and was admitted for weeks. And he has like PTSD from that and grief and all that. And when I'm seeing him for follow-up, his first question is, when can I return back to work? We know the solution, like, and it's going to have to come from something beyond what we're, I would say, politically feasible of doing. And I'm hopeful. I like talking to students because it's not going to be, it's going to be you guys hopefully dismantling it and just starting all over. Because if you guys are a public health crowd and you know what it takes housing, it takes wealth, it takes justice, and no amount of legislation is going to create that, in my opinion. It can be part of the solution, but it's going to be much deeper than that. And unless this country is willing to kind of grapple with property, purse, and like really changing that narrative and changing what that equals, you're going to have the same issues. I mean, Latinx people, are they getting crowded homes, working in meat plants, working in agriculture? Even in California, I saw a video of people picking fruit with the wildfire behind them. Our sense of humanity, and I'm part of this problem too. I mean, I'm getting that. What if the fruit I ate this week comes from someone that picked that fruit? And so it's not to say that I'm jaded. I'm actually, this is the most inspired I think I've been, and during my career, as far as because of the George Floyd rebellion in the midst of COVID. And I don't think it would have happened without COVID too. So maybe there's some divine intervention in all this and something good will come out of it. But 100% support the epidemiologic studies and all that. But like studying what people need, that's pretty obvious. It's just a matter of making it happen. So listening to activists in your community, locally, we have plenty to follow. And for us to kind of remain in diastole maybe will be a good thing, as Dr. Danielson said, and let the other people do the systole that have been doing it for years and that have had the answers for years. And now they're getting somewhat of a platform, which I'm excited about.